Good morning. On behalf of the Partnership for Quality Medical Donations Board of Directors, it is our honor and pleasure to welcome you to the 2011 Educational Forum. This year's forum reception and event today would not be possible without the support of the host organizations Tulip, Sanofi, Aventis, and Merck, so thank you very much. My name is Jen Farrington. I'm the chairman of the board for PQMD and also the director of social investing for BD, or Becton Dickinson. And I would like to thank you again for joining us this morning. As one of the earliest member companies, I have had the privilege of seeing the beginnings of PQMD in 1996, when a consortium of organizations got together to discuss best practices around quality medical product donations. Then, in 1999, PQMD was incorporated and built a strong foundation and platform to both learn and educate others on in-kind contributions, collaboration, and become today a center of excellence. PQMD since 2002-2003 has had educational forums such as this one, building on alliances of organizations dedicated to advancing quality medical donations and to help the underserved and vulnerable populations globally. I look forward to speaking to many of you today and learning from all of you as well. And if you have any questions, please feel free to ask me or the vice chairman of PQMD, Pat Baccaros from Project Hope. So I welcome you here today, and I think we have a short video to kind of start things out and just share some history around PQMD and who we are. Thank you.
Every day, more than 20,000 children die from treatable and preventable diseases. Disasters and other diseases claim thousands of adults as well. The Partnership for Quality Medical Donations is helping pharmaceutical and medical device manufacturers and international non-profits bring their hearts and their heads together to address this and other global health problems. In locations where pharmaceuticals, vaccines, medical equipment and other supplies are difficult to acquire, product donations become a significant means for obtaining critical resources. Over $4 billion in medical products are donated annually to prevent, treat, and eliminate or control some of the world's most debilitating and treatable diseases. And did you know that not all medicines and medical devices are manufactured for sale? In fact, some life-saving products are produced every year by pharmaceutical and medical device manufacturers for the sole purpose of giving them away. Medical product manufacturers partner with international non-profits to ensure that the right products arrive at the right place and at the right time. Together, they created the Partnership for Quality Medical Donations, or PQMD, a unique cross-sector alliance and learning network committed to advancing product donations that are needed, safely and appropriately. PQMD is where donors and grantees work together to develop and promote quality standards, disseminate knowledge, inform policy, and save lives. PQMD corporate and non-profit members have treated millions and are building sustainable healthcare systems by integrating life-saving medicines, medical devices, and equipment with community health programs, skilled medical volunteers, and specialized training. It all begins with determining what is needed. Members only donate products that are specifically requested by local healthcare providers. Every year, more than 10,000 shipments travel from member warehouses to trusted international partners to be used in clinics and hospitals in nearly 140 countries worldwide. When natural or man-made crises strike, PQMD members are on the ground and prepared to assist in field clinics, refugee camps, conflict zones, or anywhere they are needed. PQMD member donations are also used on hospital ships. PQMD is the go-to resource for effective and reliable education for delivery of medical donations. The innovative environment and a culture of collaboration build and transfer knowledge among members, which ensures the delivery of high-impact donations by PQMD members and other partners. Research, academic partnerships, and in-country programs contribute to building medical donation models designed to improve the impact of product donations and strengthen healthcare systems. For example, partnering with Loma Linda, Virginia Tech, Johns Hopkins, Temple and Harvard universities to carry out vital research, and working with the World Health Organization to ensure greater access to donated medicines and World Economic Forum to increase humanitarian aid. Educational meetings and tools are developed to build the capacity of product donation professionals and their partners. Interactive tools like the PQMD donation map illustrate where donations are sent and how they are used. We live in an age where networks and partnerships are recognized as requirements for leveraging knowledge and scarce resources. PQMD brings together the knowledge, experience, and skills of a worldwide network. Henry Ford once said, "Coming together is a beginning, keeping together is progress, working together is success." The unique PQMD model addresses these challenges and as a result is transforming medical product donations into health solutions.
I know that seems like a blatant commercial, but we really intended it to give you just an overview of PQMD, a little bit of our members and philosophy and programs. And it's far more interesting than listening to me go through those things, so I hope it helped. Many people I met last night knew a little bit about us, but weren't terribly familiar with us, and so we hope that between Jen's comments, mine, and the video, that will help you to have a better understanding of who we are. This event, the Educational Forum, is something that PQMD does every year and has done now for many years. And the topics have changed, but the basic idea of what we're trying to accomplish really stays the same, really the goals. What we want to accomplish with these meetings is to host an event that's large enough to have new members, new participants, a variety of people attend so that we have a host, an array of dialogue and ideas and interactions that you all can share with each other, but not so big that you can't really talk to the people here and can't really find some time to network. So that's our goal in the way that we put this together. In terms of other goals, of course, we hope it'll be a learning experience, and you heard other people talk about that as well. But one thing that we talk about at the end of the video, and that I think is all the things that we do are important, but I think one of the most important things that we do are try to build relationships and partnerships and stronger networks across donation professionals and really anyone working in global health where our members may touch them at some point. From our point of view, partnership is the key. You can have all these wonderful resources at your disposal, but if you don't have trusted partners, if you don't have working relationships, it's very difficult to accomplish the kinds of things that we want to do. So we hope this in one small way will give you another person that you can call or another idea of who's out there and what they're doing. And please let us know at any time how you think we can improve this. We will be coming back to you and asking you for feedback, but we're very anxious, especially since this is our first time hosting exactly this way. We had a meeting in London several years ago, but this is our first foray into doing an educational forum this way. So we look forward to hearing from you. Just a few housekeeping items before I introduce our first speaker. Many of you heard me say this already, but if you haven't already picked up a headset, if you're not fluent in English and French, you may want to have one of these. We are doing translation. One of the many benefits of being in a world-class facility like this is we're able to do that very easily. We're also able to videotape this. So if you have any qualms about being in an event where we are videotaping the speakers, and if any of the speakers, of course, have a concern about that, then we'll make sure that we protect your privacy. But our reason for doing that is we want to make sure that you can access this and you can show this to other people if, in fact, you think that would be helpful. So we are videotaping this. The slides that you see, we will make available to you as well on the PQMD website, also on the Tulip website, where they will be translated. So for those who are not English speakers, and vice versa, we'll make sure that we have that covered as well. And we also will provide to you a list of participants and whatever information, contact information that you think would be helpful to you. I think you have seen on your way down here the logistical setup arrangement. Breaks will be out where we had coffee when you came in. We'll have a break between each of the major panels, very short break. We want to make sure that we have time, we don't lose time towards the end of the day. But there will be an opportunity, we'll let you know, to go out and refresh your caffeine levels if that's what you need to do. And then we will also direct you when it's time for lunch as well. If you don't know, we also have lunch provided today. And last but not least, I need to take a moment to thank the people who have worked so hard to put this together. Just like any event, you just have no idea. You see the finished product and you have no idea all the work and energy and ideas that went into this. And so if you haven't met them already, where's Christine? Christine Perrier from Tulip. She is the executive director. I think most of you know her. Nadine, and I'm going to destroy her name, Mandur? How do you say? Okay, Nadine Mandur. Is she in here, Nadine? She's up, okay. Nadine is the hardworking person on Christine's staff who we could turn to for anything. I also want to introduce the PQMD staff who, in case you have a question or a problem, if you haven't identified them already, stand up, ladies. We have Jessica Warrens and we have Madeline Duffy who are here to assist you. And I think, Jen, you already introduced Jen. Pat, you did not stand up. Where are you, Pat? Okay. As our chair and vice chair, of course, and myself as executive director, we're very happy to help you. But I can't thank Christine enough. We can't thank Tulip. Merck was mentioned. But we also have Pfizer, who's hosting some meetings for us as well. And everything that you see would not be possible without their work. We're really guests here in many ways, and so we appreciate that very much.